Well, this morning we are joined by our 9 News medical expert, Dr. Kohli, and we're going to have a talk about the new Surgeon General nominee, Casey Means. So first and foremost, Dr. Kohli, what does the role of Surgeon General actually do?
Yeah, it's funny. It started in 1870. It was the top Navy doctor. And then in 1964, when we had the tobacco epidemic, it shifted to a public health role. So I want you guys to think about this person as the top doctor in the country. Okay. The biggest megaphone there is, educator, communicator, influences public policy, although they don't directly regulate it. And they're in charge of over 6,000 doctors, nurses, and scientists. So if there's a public health emergency, this doctor decides who you deploy where in terms of responding to a natural disaster. So a big position. One of my old friends, Vivek Murthy, was a Surgeon General twice over. We were at Harvard together, and he talks about just how incredible the responsibility was.
It's a huge responsibility.
Huge.
Let's get into the meat of this topic this morning, though. Casey Means. What is Casey Means' medical background?
So, she went to Stanford Medical School, so very, very impressive. But then she went into a surgical, not medical residency. So she did ear, nose, and throat. So she's never really had full medical training. And she completed most of the residency, but did not finish it, decided to drop out. So she's not board certified. She's not even board eligible. Decided to then become a functional medicine doctor in Oregon. Did that for a few years, then stopped seeing patients altogether in 2019, let her medical license expire, so it's now inactive, and instead opened a wellness company that sells supplements, glucose monitors to healthy people, does lab tests on people. And so it's really a wellness influencer is what I would call her, not so much a physician, because she hasn't seen patients now in many, many years.
So, okay, learning that, does the Surgeon General, typically, they have an extensive medical background. They are practicing physicians. Am I right or am I wrong?
Well, so they're not always practicing, but they have active medical licenses. So we've never had a Surgeon General who has not had an active medical license. We've never had a Surgeon General like her who's never really practiced medicine, traditional medicine, independently. We've never had a Surgeon General who's not finished a residency training program. And it's really the role could actually even be filled by a non-physician. So it could be even filled by, masters of public health or what have you, but that's never happened. Because if you think about it, they really need to be active practicing doctors in order to tell other doctors what to do during a public health emergency. So this is largely unprecedented. Now, during the hearing, they did tell her that she has to maintain her active licensure. They asked her if she was planning to renew her license, make it active again, and she said she had no plans to do that.
Can I go back? Because you mentioned that she went into surgical training, not medical training.
Right.
Did she complete that surgical training?
She did not. She dropped out because she said she got disillusioned with modern medicine and decided that that's not the path she wants to go. So really, like I said, she's not board eligible, she's not board certified, she's not finished her medical training. So even though she has an MD on paper from Stanford University, she's not really been a practicing physician who's seen patients independently without supervision.
And Dr. Kohli, we have less than 30 seconds, but I'm just curious, what has been the talk amongst medical professionals?
I've never seen such a negative response, Sam. Social media has blown up. Jerome Adams, who was the last Surgeon General under President Trump, has said that this would be incomprehensible, set the worst precedent to allow somebody like this to get appointed, who not only is, quote unquote, a wellness influencer, has views that are not mainstream about raw milk, about oral contraceptives, about vaccine policy that are against medicine. She says specialists create disease. The reason we have so much disease is because we have so many specialists, which is actually the opposite. It's the disease that makes us make specialists as we learn about the diseases. So I'm really worried about this type of a person having the largest megaphone that there is. On top of that, there's FTC complaints against her company for not declaring financial conflicts of interest, which to me really shows a lack of judgment. So we'll see what happens, but I know that most of the medical community is very, very outspoken about saying we should not have this person appointed.
Well, you heard it from our doctor.
I know.
Dr. Kohli, thanks for joining us here on this Friday. We do